Hey, good morning, Scurry County. It's Dan, your county judge. I've got some updates for you. Um, there's been some changes in the things have been reported. Um, like our death notifications, when we have a death that's been attributed to COVID-19 in one way or another, whether it's directly from COVID or it's COVID related. So instead of the health department getting those death certificates directly, those are going to DSHS, Department of State Health Services, and then they're coming to Scurry County, back to Scurry County. So some of those are delayed. Right now, as you know, yesterday we had two more, a male between 85 and 95, and a female age 80 to 90. And those happened earlier, but we were just able to report them legally yesterday. So there's that change. Some of the numbers that we've been going through, and I want to thank Kathy at the hospital. She is fantastic at keeping up with this. So the last 4 weeks, we had 396 new COVID cases. The 4 weeks prior to that, we had 151 new cases. So you can see it's a big jump in the last 4 weeks in our total number of cases. Our positivity rate is 20 to 22%. That's a high positivity rate when you see that most of them are 5 to 10% in the past. Hospitalized, it's anybody that has been hospitalized, anywhere from the 20s all the way to their 80s. We're averaging about 500 tests per week, 30 to 40 on the weekend, and about 100 on weekdays. So what's happening with the hospital systems? So you know that if you are hospitalized, typically you're going to go to another hospital. They're going to send you somewhere else. And those hospitals are getting strained, not just with COVID cases, but with other cases, heart attacks, or I'm assuming flu by now, strokes, and any kind of hospitalization you might need. They're going to be, the hospitals are getting strained. And the state has set a 15% COVID case limit for 7 days as far as their requirements go on what they're going to do. And so late yesterday, I got this letter from the Texas Department of State Health Services. And so with the requirement that there be less than 15% COVID cases in the hospitals, and we're seeing that strain all over West Texas, what they've decided is that with the governor's executive order GA 32, the new definitions of high areas with high hospitalizations are any trauma service area that has had 7 consecutive days in which the number of COVID-19 hospitalized patients as a percentage of total hospital capacity exceeds 15%. Until such time as the trauma service area has 7 consecutive days in which the number of COVID-19 hospitalized patients as a percentage of total hospital capacity is 15% or less. Now, this is going to be on our Facebook page. It's going to be on the COVID page, and it's going to be on Scurry County web page. And you can go and look at that on that location, on any of those locations, and they should be on there by this time. Trauma Service Area B is including us. It's 24 counties. It's the center of it basically is Lubbock County. So this is affecting all 24 counties, and it's coming from the state. I am just the messenger on this. Basically says that since we were at our 7 days with 15% capacity as of yesterday, all restaurants, retail stores, office buildings, manufacturing facilities, gyms and exercise facilities and classes, museums and libraries in all counties in Trauma Service Area B are required to return to maximum 50% occupancy levels, except in any county that separately qualifies for the greater occupancy levels because it has minimal cases of COVID-19 under the Department of State Health Services attestation process. Now, we did the attestation process, but in the last, as you can see, 4 weeks, 396 cases in 4 weeks. We are well over that minimum cases. So the state has said that we have to go to 50% capacity. We also did that attestation for bars to open through TABC. That has since been rescinded by TABC since we failed both qualifications on that, the minimal cases, and we're in the high trauma service area. So that has been a problem. So that's what the state is telling us we have to do. Like I said, I'm just a messenger. The only people who can enforce the requirements would be who would regulate them. So if it's bars, it's going to be TABC. TDLR is going to regulate some of the others. There are no fines or fees or local penalties that can be assessed against any of these businesses who violate the 50% capacity. I'm not shutting things down. I'm not telling you that it's shutting down. I'm telling you what the state has said, has told 24 counties is their requirements now. I'll give you a little update on some of the hospitals. I don't know if you've seen, been watching the Lubbock news. You may have seen where their hospital capacities are high. We're seeing that all over the place. We've had instances where we've had to ship people out from Cognell Hospital to other hospitals. We had one that had to go to Austin by a fixed wing aircraft. We've had where they've had to call 13, 14 different hospitals to try to get somebody in from here, not just from COVID, but from other illnesses or, heart attacks or strokes or anything like that. So that's the reason the state is doing that. It's because of the high capacities or high cases and high amount of people in the hospital for different reasons and not just COVID. So that's kind of where we stand right now. That's all the information I have on that. So just remember, we've because of the state's requirements, we're going to have to figure out how to slow this spread. We're doing what we can to slow the spread. If you have COVID, if you've been diagnosed with COVID, stay home, quarantine. I know there's a lot of people out there who absolutely refuse to quarantine. They're passing it on to other people. This is not something that I want us to do. This is something that 24 counties now, because people are not necessarily following the rules. They're doing what they want to do, and they're believing that, it's not really a big deal. There's a high survivability rate, over 99%, but when the state comes in and tells 24 counties that they have to go backwards instead of forwards, we need to take some self-responsibility and start doing something to figure this out. I don't like this. It destroys our economy when we have to go backwards. Social distance. If you're going to wear a mask, wear it properly. There's all kinds of studies that say that masks don't help or masks do help. If you wear the mask properly, it'll help. If you look at the CDC studies, that's what they say. So wash your hands, social distance. If you're going to be in a large gathering, social distance. Wear your mask. Have others wear their masks. Wash your hands. Do all these things that we are told that will work, that we were doing before, that was working, that we're not doing anymore. Take some self-responsibility. If you're quarantined, stay quarantined. Don't go spread it. Don't go to other places that that you could pass it on to somebody else. We've got to get those numbers down. Not just us, but 24 counties need to get those numbers down so we can open all the way back up the way we were meant to be. I don't like this going backwards. It doesn't help us at all. So with that, please do everything you can to protect us and get us back to where we need to be. Let's take some self-responsibility. Do those things that we need to do to keep the state out of our local business. All right. I'm getting off my soapbox now. I will talk to y'all soon. I hope y'all have a great day. Stay safe, please. Roads are slick. It's going to continue through tomorrow. And yeah, just stay off the roads if you can. And if you need to be somewhere, just be there, get there safely. Y'all have a good day. Talk to you later.